You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my co-host, we interview the innovators in this space every week. Ivan, please go ahead and get us started.
Hey, I'm Ivan Zach. Very excited today to introduce a colleague of mine, Dr. Elizabeth Maxwell. Dr. Elizabeth Maxwell is a diplomate of American College of Veterinary Surgeons with specialized training as a veterinary surgical oncologist. I can't even say the words today. And she is a certified veterinary pain practitioner, assistant clinical professor of surgical oncology at the University of Florida. She is a past resident of the Veterinary Wound Management Society. Now, Dr. Maxwell holds the position of president of Collaborative Care Coalition. Also, she is a host of the Margin VSSO podcast. And I just asked you, have you been on podcast? What an idiot I am.
It's a new gig.
It's a new gig. Okay, well, thank you for joining us. Thank you for finding the time. Us podcasters know how difficult it is to join initiatives like this. So thank you. Why don't you tell us about Collaborative Care Coalition and what it is about?
Yeah, so the Collaborative Care Coalition is a nonprofit that was founded in 2012. It was initially VetSoap, Veterinary Outreach and Specialty Awareness, but was rebranded in 2018 as the Collaborative Care Coalition to focus on improving the relationships between primary care veterinarians and specialists. And we do that through education, research, and service.
I have so many questions. I'm going to be quite radical about it. Do you think that the specialists are almost extinct? Nobody can find them. We can't. There's not enough.
There's
There's
not
not
enough.
enough of you guys, and I feel like something needs to change. We need to change the framework. I mean, all the big, corporates bought out all these specialty hospitals. I've heard insane amount of money that are paid to retain or attract specialists. And then I don't think that we can build any more specialty hospitals because there's just not enough of them going around. So, what are your thoughts on that? Is your project kind of helps with that? Does it help to introduce how to use specialists? And what are your thoughts?
Yeah, so there definitely is not enough specialists. And, depending on the specialty, for example, behavioralists, there are really very few in the country. And so, being able to provide different forms of access to specialty care is really important. And that's where collaborative care comes into play because, it's looking at all of the different avenues that a primary care veterinarian can extend the care that they're providing to their patients with specialty medicine. And that could look like teleconsulting, that could look like mobile specialist or standard referral. And so I absolutely agree with you. It can be challenging to find specialists and specialists that, the primary care veterinarian feels comfortable working with as well. And so building that relationship is the most important part of the collaborative care model, essentially.
Yeah, it makes tons of sense. So we had a couple of conversations about this initiative so far because we met at VMX, and now voila, you're on the show, which is super cool. And I'm sure that you've listened to the other episodes where we've talked about, startups that are in this space. There is innovation needed because the specialist generalist relationship is under siege for all of the things that Ivan has just mentioned. What are the big initiatives at the Collaborative Care Coalition? What are you guys working on, and where do you see the biggest impact, and where do you think the biggest impact for kind of moving this problem in the right direction are?
Yeah, so veterinarians love evidence-based medicine, so one of the main areas that the Collaborative Care Coalition focuses on is research and providing research to veterinarians that support that we can improve patient outcomes with collaborative care. And so we have put out, several publications on the subject of collaborative care. One looking at management of dogs with congestive heart failure, showing that dogs with collaborative care lived longer. And that in turn actually improved the revenue for the primary care veterinarian. We looked at dogs with chronic otitis, showing that dogs that had collaborative care had better long-term outcomes. And we are currently working on a study looking at perceptions of owners that have their pets managed for cancer treatments, and showing that the owner perception of their primary care veterinarian improves with collaborative care.
So I'm a huge proponent of this system of teleconsultancy because that opens up not only the availability but also the borders, because we can go across the borders with that if we're not bound by VCPR. Therefore, it means that specialists from Australia can provide consultancy to people in North America and vice versa, and Europe. And there's, as long as there's a college of recognized specialists, then it's kind of working. A couple questions are packed in that because I see Shawn wanting to ask all the questions, so I'll do it first. Do you think that's the path forward? Because that seems to me the way to scale specialist services. What is the perception of the clientele? Because some people say, well, if I don't have a specialist in the building, then they wouldn't feel like they're consulting with a specialist. And then the third question associated with it, is there a discount? Because people tend to discount telehealth because it's, I don't know, we don't have doctors that are worse than if we're using teleconsultancy. So do you think we still can charge the fees that are associated with a consultancy by doing teleconsultancy and bringing that into general practice or emergency medicine?
Yeah, that's a great question. And I think that teleconsulting plays a huge role in collaborative care. It is providing access to care. It is providing a broader spectrum of care. Those are very important topics. And, I think that when you can provide another option to a client for treatment of their pet, it gives them more opportunity to go down one of those paths, for example. And, I think the key here, though, is the relationship that the primary care vet has with the specialty. And so teleconsulting, there are various forms of teleconsulting, whether it is the primary care vet, contacting a company, that is set up for teleconsulting, and they're providing this paid service essentially to consult on a case. And there are some that also involves the pet owner, but with the primary care vet being responsible for the continued treatment. And then there's as simple as, a primary care vet just getting on the phone and calling a local specialist for advice on something. So not necessarily having to be the full case consultation. And so I think there are a variety of ways that teleconsulting can be utilized to improve the options of treatment available for a pet.
Yeah, that makes tons of sense. So, what is happening out there in the industry besides the conversations that we've had on the podcast that's exciting from either a technology perspective or a services perspective that our listeners, if they're like, yeah, this is a no brainer, like I think me and Ivan would both agree that this is, what are some things or some resources that people should check out if they're like, oh, I should be doing this as well?
Yeah, so, in terms of whether or not a primary care vet is looking to expand their options for collaborative care, there are, a number of resources in terms of companies that are providing these consultation services. Now, if they're looking for something local, I think that building a relationship with the specialty hospitals in their area is really important because they want to be able to have a trusted specialty team to which to send their clients to. Or if they just need to call quick for advice on something. I think that we tend to be very formal when it comes to, hey, I have a complicated case, I'm going to refer this case. But building that relationship, even in a friendly way, whether that's going to local conferences together or being able to meet up at, non-work events, it's important for the specialty groups to reach out to their primary care veterinarians in the area to develop that relationship. And while teleconsulting helps to expand the options again for the clients, especially for some that maybe can't drive to, local specialty groups because maybe they're 1 to 2 hours away. Teleconsulting is a great option. But again, I think that the key here is being able to build a relationship with the specialist that the primary care is using or extending their services to.
So you mentioned a couple platforms, and we're not sponsored, funded, or anything, so we can say anything here. And as long as it's not competitive to you, let's name a couple. I know my friends at VetCT. I think that's an incredible project. So they're doing a great job. I think they have north of 200 specialists right now. Are there any other platforms that you know of that we should check out and kind of see where they are, depending on location, time, availability, or anything like that? Or unless that contradicts something that you do and you don't want to.
Yeah, no, no, that's a good question. We're right now actually looking at developing an affiliate program where we reach out to some of these, groups and not vet them, but check them out and see if they have the same vision of collaborative care that we do, and the same mission for providing that additional care option to the primary care practitioners. And our goal is to eventually have a resource available through the collaborative care website to provide a direct resource to these affiliates that again share this collaborative care mission.
Yeah, I think that's a great and fantastic idea. I mean, like IDEX has their telemedicine group, and they have surgery and specialty and radiology, and there's Vital Rads, and there's all of these other groups that we've come across over the years. But I don't think there's a benchmark of any of these people, or even like a Yelp reviews of what the veterinarians that interact with these services think of those interactions. And what an incredible opportunity for your guys' coalition to put this resource together for any veterinarians that are looking to kind of expand the depths and breadth of their offering when it comes to this idea of collaborative care. Why are you doing this?
Well, the just to give a little bit history on the Collaborative Care Coalition, it was initially started by Robin Brogdon back in 2012 as the Vet Soap, as I mentioned, and it was due to the lack of awareness that specialists even exist, and there was a lack of, again, that relationship between the primary care vets and the specialists. And it was kind of this vision that we needed to strengthen those relationships. And sometimes veterinarians take everything as a competition, right? And may not be supporting each other as we should be. And this leads to, again, mental health issues in the profession. And I've got involved with Collaborative Care Coalition several years ago because I wanted to be able to help strengthen those relationships and educate the public, educate primary care vets, and educate specialists on what characteristics help to improve their relationships with each other. And, being able to improve these relationships will relieve stress on your teams because have a friend in surgery or a friend in internal med that you can reach out to. It helps to, again, improve access to care, which, again, is a barrier, right? So cost is a barrier, distance is a barrier. And this collaboration that we can have between both the primary care and the specialty groups will help to address all of these issues.
I do want to share a story about me using in my early days of veterinary career, as specialist, an exotic specialist. I hated dealing with birds. Like, I just don't like birds, and they bite me all the time.
Oh, finally, a Christmas gift idea.
So I was on Vancouver Island in the only emergency hospital in the entire island at that point, and someone called and said that they're coming a couple 100 kilometers away with a 60-year-old macaw. And they said, "You're the only emergency hospital open." And I was like, "I don't want to see it." No. And they're like, "Well, you're the only emergency hospital, so you need to see this bird." And I said, "I don't want it, and birds die on me in the hospital, so I don't." So they ended up driving, and I found an Atlantic. So there was, I don't remember what's Benoit, I think. I don't remember his name. He was an exotic specialist in Halifax. So I actually ended up calling him and consulting, and he kind of calmed me down. He was like, "It's the same animal, draw blood, take an x-ray, they're big enough to do enough diagnostics." So that was sort of my trial of that, which was very helpful because I was a new grad in ER vet. This bird came in. He did look like he was 60. I was worried because there's 3 generations of people take care of this bird. And then I put him on his side on the x-ray table, came out, took an x-ray, came back. He was not alive anymore. So not a good story, but I remained calm through the process because he helped me. So Are there, from that story, is there a map where general practitioner who doesn't have access to, anybody locally that can tap into this world of specialists that remotely can help them and kind of broaden their base of services that they can provide, tapping into this network?
I think right now there isn't really. There is one website resource through internal medicine, ACVIM, that does allow you to look for specialists, geographically. But again, as I mentioned, what we're hoping to achieve with our affiliate program is to be able to provide that resource where we can connect, primary care veterinarians with these specialists. The other thing that the CCC offers is a partnership program. And this partnership program is designed to help educate and help hospitals develop the tools needed to improve their communication with each other and improve their collaboration. And so eventually our goal is to have a consultation service that is hospital tailored. And then we can actually provide direct services to the hospitals in order to help improve their collaborative efforts and improve their access to the resources that they need.
That's so awesome. Ivan, thanks for yet again another inspiring story about how an animal died in your care. Very, very lovely.
I don't do this anymore. I do podcasts. So
It's a
so
good
everybody's
thing.
safe.
It's a good thing. So, Dr. Maxwell, what's coming next for the Collaborative Care Coalition? And paired with, if there's audience members that would like to get involved and help with your initiatives, what kind of help are you looking for?
Yeah, so just for looking for more information, they can visit our website at the collaborativecarecoalition.org. And we are always looking for partnerships and sponsorships to help develop the research, again, to support collaborative care, improving patient outcomes. And we are also looking for, partners that share our mission. We also do speaking engagements where we can talk about collaborative care and the research behind it. We do conference lectures, CE, and if they want, again, to look into our partnership program to help grow in collaborative care, we can also help with that.
Super awesome.
That's awesome. And we are, as usual, at the end of the episode. We always ask two questions at the end. One of them, is there a book, TED Talk, YouTube video, anything that inspired you recently that you would suggest to our listeners?
So you may know Simon Sinek, but I'm a big fan of all things Simon. So I, are constantly listening to his new stuff to feel inspired.
Well, I think that he owes us some royalties because that's been brought up so many.
Probably.
Yeah, we need him to come on the show. We got to look for that.
We should contact Simon. Say, hey, Simon, what's going on? It would be funny if we did get him on the podcast. Did we talk about that? I think it would be
Great
awesome.
idea.
It's probably like a zillion amount of dollars to do that for him to get onto our podcast. And the second question that we ask, is there a guest in the industry that you think it would be interesting to invite to this podcast as well?
Yeah, so Jared Stanton, he's the founder of Xero Vet, which is a virtual reality medical procedure database that is available as a resource for students and universities. And they actually offer that free through Vin.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.